Can you comment on how we discriminate the prognosis for patients with MDS?
Sure, and I think this is actually a complicated discussion, and patients often when they look online they'll see that there are numerous classification systems. But I think that the two that it would be worthwhile to comment on, one is called the IPSS, or the International Prognostic Scoring System, or you'll hear the RIPSS or IPSS-R, which stands for the Revised International Prognostic Scoring System. These are the two that are clinically most commonly used. And really what they divide patients is, do you have lower risk disease or do you have higher risk disease? And really the two things that means, patients who have higher risk disease unfortunately have a higher chance of developing acute myeloid leukemia and have overall a lower survival over time. We also treat these patients considerably different. With higher risk patients, and we're going to talk about this later, we focus on somewhat more intensive therapies and curative strategies such as transplant, whereas lower risk patients, we really focus on treating the symptoms of the patient, helping their quality of life and improving blood counts over time. And these systems are also constantly evolving. So again, we've commented that we're learning about these mutations. We're now starting to incorporate those even into their traditional prognostic models to help really give a more personalized prognostic answer to our patients when they ask, how long do I have to live? What is my risk of leukemia? We're really nowadays being able to answer that much more precisely than in the past.
Can you comment on which specific categories in each of these systems that you would consider lower risk versus higher risk?
That's perfect. So I think probably the easiest one to discuss would be with the IPSS. So patients can be what is called low risk or intermediate 1. Together those group what we call lower risk. And then there is intermediate 2 and high, which together that is grouped into higher risk. And when we talk later about in treatment, typically when we're referring to lower risk and higher risk, we're referring to those two separate groups based on the IPSS.